name's Peta Bailey. I am a doctor of Chinese medicine, and today I'm speaking to you on behalf of Bendigo Chinese medicine. What I've been asked to talk about is it's a question that we're asked a fair bit by our clients, and it's a challenge that faces us as Chinese medicine practitioners, and that's basically the requirement in our culture that in order for us to advertise or to put it out there into the community that that Chinese medicine can be of assistance to you in any way, then we need to back up those claims with evidence-based scientific clinical trials. And what we're often asked in Bendigo Chinese medicine is, why we don't put those clinical trials on Facebook or on our website, and use it to promote some of the conditions that Chinese medicine is able to assist with, and here's the proof. The reason why we choose not to do that is basically because of the very different paradigms, for want of a better word, that is Chinese medicine, not versus, but as a polarity to Western medicine or scientific thought. And that is that at its very heart, its very essence, at the very core of Chinese medicine exists what's considered the unknowable, or the unquantifiable, or the great mystery. There's an element that we call qi. You might have heard of it before. Qi is energy, and qi is undefinable. It is the source of life. The issue with science and clinical trials, as we see it, is that science and clinical trials and the need to prove that Chinese medicine can be of service, or a particular herb or a particular acupuncture sequence can help with something, is based on being able to measure a result. So basically at the very heart or foundation of the scientific model, of the evidence-based model, is that something needs to be able to be measured, it needs to be able to be quantified, it needs to be able to be reproduced in order for it to exist. And if that can't happen, then it's not seen as being evidence-based. The problem with that model of care is that it's limited. It's limited to the technology that we actually have available to us at this time. So this idea of qi, or this idea of energy, basically, we haven't developed, or we are in the process of developing the technology to actually measure something as fine or infinite, or as just like qi. So it's quite challenging then to subject Chinese medicine to Western scientific rules, when the rules are kind of made up, they're sort of stacked in their favor, because at its heart, Chinese medicine has something, this essence, this qi, this mystery, this unknowable, this unquantifiable, that will, no matter how many times we do a clinical trial, there will always be that element that means that you cannot potentially reproduce and know that that's going to happen, because ultimately it's based on this idea that every single person is an individual and every single moment is different, and there is always these other factors that come into play. So as Chinese medicine practitioners, there is certainly, we can spend our time doing research, and we can put on our website the clinical trials that have been put out there in order to back up that yes, we can, look, evidence shows that Chinese medicine can help with this, or look, this, it shows this. But the challenge with that is that it's actually really missing the heart of what makes Chinese medicine, because as soon as you start measuring it, as soon as you start quantifying it, as soon as you start trying to limit it and put it into a box, you take away what is essentially the mystery, and what is the magic, and what is that unknown element that can never be controlled. So we choose not to put those trials. Sometimes, we can certainly give them to you if you're interested, but we choose not to invest our time and energy into it, because it's coming from a different model of thought, a different model of medicine, a different way of looking at the world, and that has a valid place. But when you try and fit Chinese medicine into it, it's like trying to fit a round globe into a square peg, or whatever that expression is. They're different. They're a polarity. They're complementary. They both have something to offer. But by trying to get Chinese medicine to conform and comply when the rules are set by science, you lose Chinese medicine. It is no longer Chinese medicine. It becomes a limited model where the qi is taken out of it.